So we're really privileged to have Sheridan Nicolau, who is a regional manager for the state council here. Um, Sheridan, thank you so much for joining us today. Can you tell us a little bit about what is the state council on developmental disabilities?
I'm happy to, and thanks for having me today. So, a little bit about the State Council and about our work for Californians and how you can connect with us in the future. The California State Council on Developmental Disabilities believes that Californians with developmental disabilities are guaranteed the same full and equal opportunities for life, liberty, the pursuit of happiness, just as all Americans. And so, with that in mind, we advocate, we promote, and we also implement policies and practices that achieve everything from self-determination, independence, productivity, but most importantly, inclusion in all aspects of community life for people with developmental disabilities and their families. And so, at a big picture, this is what we do. So, we empower individuals and their families through activities and systems navigation that teaches self advocacy skills and supports self determination. We advance public policy and systems change to help people gain more control over their lives. And we also do a lot of projects that help build capacity within systems and within the community overall. And we do this through a plan called California State Plan. We develop a state plan every 5 years with input and involvement from our community. And then we submit this plan and the annual reports of our progress to the Federal Administration on Community Living. This work isn't just in California. There's actually a state council in every state and US territory in the nation. And you can read more about the state councils as well as the state protection and advocacy systems, also known as PNAs, and the University Centers for Excellence in Developmental Disabilities, also known as UCEDS, and the projects of national significance. Those are all located in the Federal Developmental Disabilities and Bill of Rights Act. The DD Act, as it's often called, talks about these programs that conduct research and test innovative best practices and new service delivery models. And they also bring the latest knowledge and resources to those that can put it to best use across the nation. But most importantly, these programs of the DD Act, they empower individuals with developmental disabilities and their families to help them get involved and to help them shape policies in ways that impact their lives day to day. And the State Council's role here in California is also detailed in the California's Lanterman Act. And here's where you can read more about that act, which is also codified in the California Welfare and Institutions Code.
So Sheridan, who do you serve, and once again, who do you work with day to day?
Yeah. So we work with people with developmental disabilities, all ages, all life stages. We work with their family members, their friends, their allies. We work with cross-disability communities and civil rights advocates. And we also work with public and private sector services and systems. And, in terms of our staff, we have both bilingual and multilingual staff across the state. We also utilize language line services so we can get professional interpreters over the phone in a relatively short amount of time. And for a lot of our events, our trainings, different types of workshops, we can offer language interpretation, ASL, and other access accommodations. So just let us know what you need to fully participate. And so most people interact with the State Council through the Council's regional offices. And the State Council has regional offices all across the state. We have 12 of them to best meet the diversity and the scope of the needs in California. And so what we do there is we do a few different types of things. We connect people to needed services and supports in their area, give them information about their rights, information that's relevant to their local community. We strive to improve services and supports, review practice and policies, see how those systems are actually serving people in that area, help them build capacity. And we help people be a part of their communities and just get them involved in areas of their interest. And much of the work of the State Council staff can be grouped into what we consider to be three buckets: advocacy, capacity building, and systems change. So let's look at some of the examples of this work. So the first bucket is advocacy. This includes helping people navigate various systems of services, supports, benefits, that kind of thing. Trainings, so that people know their rights and what's available to them. Technical assistance, which provides person-centered advice or guidance or resources for people. And collaboration with others, especially for those that have shared values or advocacy interests. We really appreciate doing that. The second bucket has to do with capacity building. And so that can be everything from serving on coalitions and committees, again, providing trainings or different education and outreach opportunities, connecting folks with disabilities to different seats of power or to leadership opportunities so that we have strong representation in positions of power. We also have annual grants, both statewide grants and regional grants, as well as year-round sponsorship opportunities. And we also advise and support leaders and communities that are dedicated to advancing rights and equity forward. You know, some of that is also supporting leadership bodies and different committees. For example, California Self-Determination Local Advisory Committees, People First chapters, and a variety of other self-advocacy groups and networks across the state. The third bucket of work can be described as systems change. So that can be anything from shoring up systems that serve people with developmental disabilities, again, keeping an eye on policies and procedures, and influencing policy by mapping out the true impact of people with developmental disabilities and folks with other disabilities. So on a state policy and legislation level, some examples include our co-sponsorship, for example, of California's SB 639. That's a bill that passed last year that ensures that California transitions away from paying employees with disabilities less than minimum wage. Or our service on California's COVID-19 Advisory Vaccine Committee, or the work that we do with legislative offices to make sure that policymakers across the state both hear and really understand the needs and the concerns and the feedback from their constituents with disabilities. And on a county or a regional level, we also serve on committees and coalitions, including county COVID-19 advisory committees, planning commissions, and advocacy-related collaborations that advance those rights and access and equity for the folks that we care about. And so those are a few ways, but many people also get involved with us through our regional advisory committees, otherwise known as RACs. So we have a RAC in every state council region, so that's 12 total here in California. The RACs advise the state council and the regional offices on local issues that matter. The RAC provides input regarding local systemic needs within that community that they serve, and provides public info programs for folks with developmental disabilities and their families and professional groups, public awareness campaigns, that kind of thing. Those RACs are representative of the diversity of that particular region within California, and they hold public meetings, usually many a year, oftentimes every couple of months. Members that serve are community members, local leaders. They serve terms up to 2 terms of 3 years apiece. Sometimes regional advisory committees form work groups for specific purposes. For example, here in the Bay Area, in the last couple of years, we had a work group on racial justice. We had one on healthcare clinic quiet lab settings, and we had another one recently on conservatorship reform here in California. Important to know that RACs can make recommendations to the council, but they can't take a position that's independent of the council. And each RAC has somewhere between 9 to 15 members, depending on the need, and at least 35% of the RAC members are people with lived experience with developmental disabilities, with another at least 35% being family advocates, and then the remaining service providers or other types of professionals in the community.
So Sheridan, can you tell me a little bit more about the council, really how it's organized here at the state level?
Sure. So the state council itself has 31 voting members. About 60%, at least 60%, are people with lived experience with developmental disabilities and family advocates. And the council focuses on long-term solutions through systems change work and represents all of the diversity of California. So 20 of the 31 voting members are non-agency members who reflect that socioeconomic, geographic, disability, racial, ethnic, and language diversity of California. and our leaders, again, either with lived experience with developmental disabilities or our family members. And so aside from those 20, the remaining voting members of the State Council include directors or designees from a variety of departments, such as California's Health and Human Services Agency, the Department of Developmental Services, the Department of Rehabilitation, the Department of Education, Department of Healthcare Services, and Department of Aging. And then lastly, the remaining voting members are from one non-governmental agency, California's Sibling Leadership Network, and our Developmental Disabilities Act federal partners, and that includes Disability Rights of California and the University Centers for Excellence in Developmental Disabilities. So that includes UC Davis's Mind Institute, UCLA's Tarjan Center, and USC's UCED at Children's Hospital of Los Angeles. And the council has public meetings throughout the year where you can listen in and give public comment. The council also has a variety of committees that hold public meetings throughout the year. And we really encourage you, take a look on our website or take a look at this list here of the committees of the council. We encourage you to keep tabs on what we're doing, maybe bookmark or council calendar and join in on the meetings of your interest in choosing for advocacy. So that includes everything from Self-Advocates Advisory Committee, our Legislative and Public Policy Committee, the Employment First Committee, State Plan Committee, the Statewide Self-Advocacy Network, Statewide Self-Determination Advisory Committee, and we also have self-advocacy chats, so bringing together self-advocates from across the state. And lastly, your local state council regional office would love to see you at events, trainings, collaborations, or outreach, either online or in person. So take a look at the contact info for the State Council Regional Office that serves your county. We'd love to hear from you. And thanks for being a part of our community. And thanks for tuning in and for your role in securing and upholding access, equity, and inclusion for all.
So, Sharon, how would you find your counterparts here? As you said, there's multiple regions in California.
Yeah. So you'll see on the slide here, we have a regional office near you. Look for your county in this list, and there's the phone number in the website for that regional office. So if you reach out, you can find out about your local RAC meetings, upcoming conferences or trainings or events. Lots of ways to get involved.
You know, the State Council is always a great source of information here, and once again, I believe I'm on your mailing list for both the local and the state. How does one do that? And what kind of information are we going to get if we're on the mailing list?
Yeah, great question. So this last slide that we're sharing with you has our website, as well as contact information, email, phone number, and the like. You can see we have here a link of how you can join our email list, and you can choose. You can choose to only be on your local regional office mailing list, email list, or you can choose to also be on the statewide list and get notices about legislation, advocacy opportunities, big statewide happenings that are important for advocates of all kinds to know about. Your regional list is going to let you know about what's happening locally. So everything from rights trainings or conferences or other activities based on different interests. And then we also want you to get social with us. You'll see our Facebook contact, Twitter, Instagram, LinkedIn. So however you prefer to stay in touch with us, we'd love that.
Let me throw out one last question here that I get all the time. Is the State Council part of the regional center, or are you separate? And I know you went through the federal mandate, but oftentimes I think there's a lot of confusion about that.
Yeah, I think it's because our regional offices are called regional offices, not to be confused with regional centers. Absolutely, we are separate entities. We're both in federal and state law, as we discussed earlier. So regional centers are independent nonprofits that receive funding through the Department of Developmental Services for California. So very separate entities. In some cases, the State Council may partner with regional centers or with the Department of Developmental Services on shared goals and objectives, working towards access, services, and equity for people with developmental disabilities. And other times not. We're also making sure that systems like DDS and like regional centers are well serving people with developmental disabilities and their families. That's a big focus for us.
I want to thank you so much for joining us today and sharing the work that you do. And I know just for myself as a professional, a family member, and as an advocate, I know the information that I get out of the state council here, both at the regional level and the state level, really help me try to make some sense out of this system.
Well, thanks for all you're doing. It's always great to partner with you.